Hey everyone, it's Dr. Tim Whiting of Stirpe Chiropractic and Wellness Center here with another episode, so thanks for tuning in. Today we're going to be talking about neck pain. Often we'll see people coming in with neck pain, even pain radiating down the arm, or headaches. So some of these things are mixed in with one another, and it's going to be my job when you come into me to figure out what's really going on. So a lot of times people might just wake up with a kinked neck, so to speak. They wake up, they really can't move their neck. Usually we're looking at a muscular strain. Something happened overnight or something got locked up. So that's one of the common ones. Post-motor vehicle accident, so something like a whiplash injury is something that I see very common in here. Herniations, just like they can happen in your lower back. You can get a disc herniation in your neck as well, which can create pain down your arm. Other things that can create pain down your arm is something called thoracic outlet syndrome, where the nerves get compressed more towards the shoulder. And again, it's going to be my job to figure out where they're coming from, if it's from your neck or if it's from the arm more. So these are things that you leave to your health professional to figure out what it is. I don't want people self-diagnosing, but just know that these are things that we commonly deal with. So there's neck pain, radiating arm pain, and headaches and things of that nature. So here we have the spine, just to kind of show you what we're dealing with. So obviously the neck is the most upper part of the spine, so it's going to be in this area here. You can get pain just from these joints in the neck, which is a lot of time what we as chiropractors focus on, is manipulating or adjusting these joints, which we'll show you later, to loosen them up, to make sure that they're moving properly so that things aren't locked up and creating any pain. You got to think all the muscles throughout your neck also attached through many of these joints as well. So that's going to be another component that I'm looking at, making sure that we don't have any muscle imbalances, either tight on one side or weak or something like that we're going to be focusing on. They can also create certain types of headaches. So if we've got the joints of the upper part of the neck up in here that are really locked up, you can get what's called a cervicogenic headache, where it kind of comes up the back of your head. And again, it's my job to differentiate if it's coming from your neck, if it's coming from some tension style headache, like maybe your muscles, your upper traps, or if it's a migraine or a sinus headache or something. That's what I'm going to be figuring out and then coming up with a treatment plan for you. Some things, kind of like we did with the low back series, some things that you might be able to do at home initially if you can't get in to see your chiropractor, your medical doctor, or physical therapist, or whoever you're going to go to for this complaint. Really want to do something to take the edge off. If you go to your medical doctor, chances are they're going to prescribe you some sort of medications and say you take over-the-counter stuff. We try to keep it as natural as we can. So for me, something like this product, this is made by Standard Process. It's called Boswellia Complex. Basically, it's got boswellia, turmeric, and ginger in there. Those are three phenomenal anti-inflammatories, also help with a little bit of muscle relaxing. So this is something that is going to be a natural form of an anti-inflammatory. So this is something I highly recommend. I try to have patients have on hand, so if anything, they have an acute flare-up, they can go right to this and get on it soon. Other things we've talked about before is biofreeze, icy hot, things like this that are just going to create that cooling effect. You're going to spray it over whatever's bothering you, back of your head, arm, whatever. This is going to create a cooling effect, which is going to help with some pain, ease some pain. Similarly, in the form of a patch though, so these Theraderm patches that we have, they've got menthol, they've got eucalyptus and lavender and all sorts of other things in there that are going to help naturally with some of the pain as well. So you're going to place this patch right over the area. It just stays on a little bit longer. It's not as messy sometimes as some of these sprays or gels like biofreeze might be. So these are another affordable thing that you can use in the acute stages. Classically hot or cold packs, so we've got the one here you can use either way. Heat it up in the microwave or boil it or keep it in the freezer. So that's going to be depending on what's going on, if you're going to respond better to heat or cold. That's something we can help you with, or just kind of do it yourself and figure out what works best for you. And then also, just like low back, if you've experienced rock tape before or kinesio tape, something like that, we might be applying this when you come in if you have some at home and you know it's more muscle related. If you've had it in the past, you can apply some of this and maybe take some of the edge off until you can get in to see somebody. So those are some quick at-home things if you really don't know what's going on until you can get in to see and have your health professional really figure out what it is so we can go forward with treatment. Many times when you do come in, It is multifactorial. It's usually muscle, joint, maybe even a little bit of ligament related. You know, cervical spine is not as common for disc herniations, but they can happen there. So if you do come in with a disc herniation, one of the things that we might do is what's called cervical traction. Much like we showed you the traction on stretching the low back, it's going to be very similar to the neck. It'll be looking something like this machine that we have here. You're going to place your head in this. The strap will go over there. You can see kind of from the side here. And then as we spin this, this part will slide up while your lower head stays in place. And this will create that lifting effect to kind of decompress your neck and get that pressure off that nerve that might be shooting down your arm. So this is very helpful when it comes to a disc herniation in the neck. Then classically, our go-to is going to be cervical manipulation, which we've shown in the past, and I will show on Dan a little bit later. And those are really our go-tos. We're going to help work on those muscles, stretch you out, maybe throw you on some traction, and then send you home with some stretches and exercises, which are going to be dependent on what your condition is. A lot of times, you know, you'll see some stretches where you're just pulling your head to your side, maybe coming a little bit forward, focusing on the larger muscles in the back of your neck, your traps, your scalenes, usually the go-to muscles for that. So those are kind of some ones that we're going to be working on. We might also send you home with some strengthening exercises where we're going to give you a band and we're going to work on stretching out your pecs while strengthening the muscles behind your shoulder blades there, your rhomboids. So something really simple, band out in front of you. We're going to do some scapular retraction type exercises. Or maybe some head retraction where if you're kind of in this posture all day at a computer, our whole idea is to get up here. So we want to bring this head back directly. So those are some things that we'd go over more in depth with you when you're in the office and depending on what fits. Another huge one that patients seem to really enjoy, especially if they've had chronic neck pain, is a pillow. You can try memory foam pillows, try whatever pillows kind of work for you, but what's nice about this one is it's called a Chiropractic pillow, and it's actually got a water bladder on the inside, so it's adjustable. You fill it with different amounts of water, and it'll obviously increase how much support is in there. So you start with a certain amount and either increase or decrease how much water is in there for the amount of support you need. What's nice about that is when you put your head down on it, it's going to displace the water to the areas that need more support. So you're not going to be in this drooping position. You're not going to be in an extreme position once you get it adjusted to yourself. So again, very adjustable, lasts a long time. You can wash them and then just be like a normal pillow for a pillowcase on there. Only thing sometimes people complain about is the weight of it when it is filled, but it's filled with water, so as long as you're aware of that when it comes time to lift it off the bed, you should be fine. But this is a great one that patients really seem to enjoy. So I'm going to have Dan come over. I'm going to show you that cervical manipulation again. This would happen after we've already diagnosed you, figured out what's going on with you, and if you're right for cervical adjustments. I've worked with him before, so I know he is a candidate for cervical manipulation. Usually someone would come in, I'd probably do some traction, work on those muscles in the neck, and then finish off with the adjustments and some exercises and stretches. So I'm going to have Dan come over and I'm going to adjust him so you guys can see what that looks like. Alright, so again, after we've already examined you, in this case I've worked with Dan before, so I know that he is a candidate for manipulation. Right now he's just got some general neck stiffness and pain in through here. We would work on some of these muscles to really get them to loosen up. Then I'd kind of find where I want to adjust. We'd find some areas of restriction where it's tight, where I feel that we need to get some of these joints moving. This is going to help get as a natural painkiller, as well as correcting what might be at fault for your neck pain. So I'm going to have him lay on his back and we're going to show you the adjustment here. We are always aware that this one can be a little bit intimidating to people if they've never been adjusted before. I make sure we walk everybody through it. Start off nice and light. I don't do anything that patients don't want me to do or try to surprise them with anything. So I explain to them what we're trying to accomplish, that popping noise that they might hear so that it doesn't scare them when they do hear that. Other than that, the more you as a patient can relax, the more comfortable the adjustment is, the more relief that you're going to get right off the bat. So people usually find this to be one of their favorite adjustments as we get going. One side, find the other side. So just finish off with a nice light stretch to help the patient relax a little bit. And that's as simple as that. Again, usually, almost always painless, relaxing to them and comfortable. Typically walk out of here feeling a little bit better, feeling like they can move their neck a little bit more, maybe got some of that pain out of their arm, feel looser, maybe even feel a little bit better mood. Sometimes I've seen that happen quite a bit as well. Just kind of get a little head rush from it and usually feel a little bit better. So again, some of these things, excuse me, some of these things may vary depending on what you have going on personally, but that's up to me to decide what things will fit for you, okay? Thanks for tuning in, and we'll see you next time.